straight over to Michaela, who is from the respiratory team here at LTHT, who can do a quick presentation on that for us. Thanks, Michaela.
Hello everyone, I'll just share my slides, just bear with me a second. Can you all see that? Yep,
we can.
Brilliant. So I'm just going to discuss a little bit about managing a respiratory long-term condition. If you are employed within the hospital and have a long-term condition that's related to respiratory, or if you're managing someone with a respiratory long-term condition, what you can do to help. So the objectives really is to talk about self-management, so that individual, how they can self-manage their respiratory condition. Now, bearing in mind, respiratory conditions covers a huge range of different conditions. So we've got asthma, we've got COPD, we've got bronchiectasis, we've got interstitial lung disease, fibrosis, sarcoidosis, some of the neuromuscular conditions as well. So it covers a huge amount. So I'm going to speak very generally, but if there is additional information that people need, I'm happy for people to contact me. I'm going to talk about support in-house. So in the hospital, what can we do to support your respiratory condition? And then external support that's out there for people that are living with a long-term respiratory condition. So self-management is probably the key thing that any one individual can do. So if you have an employee that has got a respiratory condition, get to know them, get to know whether they're having their yearly reviews. If you have a respiratory condition, you need to be having a yearly review with a specialist from your GP if you're not referred into our specialist service. So things that will happen during a yearly review, I will look at how many rescue medications you're needing. So are you needing a lot of salbutamol, so your reliever inhaler? Are you needing a lot of steroids? Are you needing a lot of antibiotics? You know, have we got you on optimum therapy to be able to manage your symptoms? There's also a huge emphasis on inhaler technique, and many people that we see will say, oh, I've been taking that years. I'm absolutely fine with that. Don't need you to check my inhaler technique. And actually, when you say, oh, just humour me a little bit and show me, you'll find that a lot of people take their inhaler wrongly, especially if they've got MDI, which is the little pressy squirty one. Not many people can coordinate taking that inhaler well. So always ask either your pharmacist or your specialist nurse if you can just get an inhaler technique. There is also really good information on Asthma UK website that shows you how to take your inhalers and shows you videos on how to take them correctly. Symptom tracking as well is a really useful method. Now, people have different ways of doing it, and I'll come on to this more. And there is different apps out there where you can check your symptoms and track them. Certainly with asthma or COPD, we want to be knowing what your symptoms are doing, how you're feeling every day. You know, is one part of the day worse than another, or is it variable? Are we, you know, is there environmental factors that are triggering things? Also, we want you to improve your exercise tolerance, which sounds really daft, doesn't it? That I'm talking to you about not being able to breathe, and then suddenly I'm telling you to get exercising. Well, your respiratory drive is a muscle, and what we want you to do is use that muscle. The less you use it, and the more you conserve that energy, because you're thinking, oh, I can't do that because I'm going to get out of breath, the more you get breathless, and it's a vicious cycle. And then what we find is that people are more breathless because they're doing less and we're not using their muscles effectively. And we'll go on about pulmonary rehab and why that's important. Compliance with medication prescribed. Now, this is really common in some of our variable respiratory conditions. So somebody say that's got asthma that doesn't feel bad all the time, so they stop taking their preventer inhaler because they feel better. So why would they take it, and why would you pay for another prescription? Well, the reason for that is the preventer is there and it's doing the magic in the background. So what we want to do is take that inflammation down within the lungs, and by not taking it, we're stopping that inflammation. So the inflammation gets worse and then we become more symptomatic and then we have more exacerbations. So what I always tell everybody is that your preventer is your magic in the background. That's your one therapy that I want you to be religious with. I want you to take it every day, no matter how you feel. I want you to take that medication every day as prescribed. Your reliever is obviously your salbutamol, and that's to be taken as and when your symptoms get bad. Now, the other big driving factor is smoking cessation, and often a lot of our respiratory patients feel like we almost ran this down their throat. And the reason for that is that there is so much evidence out there to say that smoking is so harmful, and if we stop the smoking, we obviously stop things getting worse, especially in our COPD patients. So internal support, what can you do? And, you know, it's quite useful for me to do this because, you know, I've had 8 years of being a line manager and managing a big team of staff, and it's really important to talk to the line manager. It's often very scary and you don't want to be segregated because of your condition, but equally your line manager is not there, you know, to judge or anything like that. They're there to support you. And talking to your line manager then opens up. So if you were off sick and you go into a sickness process, they're aware of everything that's going on with you, and it makes it so much easier to manage that situation and to create achievable targets. So we know that you may have a flare up in winter, so we may be able to say, oh, you know, we'd want 0% sickness from everything else, but actually we're going to account for some of them flare-ups during the winter month, and, you know, we may be able to give you, you know, a couple of episodes of sickness, you know, and account for that during those winter months. Trust support, making reasonable adjustments. Now, some of our respiratory patients find morning the worst time. You know, we're now in a trust that works lots of different shifts. Can we move them shifts? Can we do more late shifts? You know, can we do a shorter day rather than a longer day to conserve some of that energy? Mindfulness and stress reduction is a big driving factor. So a lot of our respiratory conditions are exacerbated during stress periods. So it's really important that we just think about how we can reduce that stress. And practice some mindfulness as well. There's lots of free apps available out there to be able to do mindfulness. I know certainly in our CSU they have mindfulness sessions every week that you can attend if you want to. Healthy living and well-being as well, so looking after yourself, eating healthy. If you're feeling breathless, a lot of our chronic conditions, we ask you to eat very differently to how we would advise you normally. So we say high calorie, you know, small volumes, little and often, but lots of calories in there. So we go from telling you to eat healthy all the way through your life to then having a chronic condition and is telling you to drink full fat milk, eat cakes, you know, get them calories in however you can eat them. Just because you're burning off so many calories while you're breathless. So really important that you just look at your weight. Certainly with COPD patients, we find that people of a higher BMI, so I'm not talking massively overweight, but on the higher side of the normal BMI, have much better outcomes in terms of symptom management and how they progress through their disease. External support. Now, there's a lot of money being put into respiratory at the moment. They've seen it as massively underfunded, and they've also seen that it is a preventable disease in some cases. So you will see over the next, hopefully, 5 years, there's a plan in place to massively improve respiratory services that are available to everybody. There are things like apps. Now there's a My COPD app and a My Asthma app. At the moment, Leeds CCG haven't undertaken the asthma app, but My COPD app is available through the Leeds CCG. So if you do have COPD, you're quite tech savvy, then I would recommend speaking to your GP or your respiratory nurses out in the community and just getting set up with My COPD app. It's really good. It looks at your daily symptoms, so it tracks how you're feeling, how often you're using your reliever. It's even got things like how to manage breathlessness, secretion clearance. So there's videos on how to clear your sputum if you're very symptomatic from a sputum point of view. It also has got pulmonary rehab online on there as well, which is fantastic. So, and it tells you the pollution in your area as well, so you can, you know, make adjustments if it's high pollution that day. Other things are community services. So we've got an integrated COPD service, so we link in with them, but they're mainly based out in the community, seeing all the respiratory patients, and then have a weekly MDT with a consultant. So if you are finding that you've got COPD and that you are having more and more exacerbations, speak to the community respiratory service. They will see you, and if appropriate, will then refer in for us to have a little chat about symptoms and how we can manage things. Again, I can't stress attending that yearly review with your GP specialist nurse every year. A lot of people just overlook it and think, oh, I'm okay then. And then 3 months down the line, hit a bit of a hard situation where they're exacerbating quite a lot. We could have probably preempted that if you'd have had your yearly review. Pulmonary rehab. A lot of people, as soon as we mention pulmonary rehab, say, oh, I'm not going to any exercise class. It can be done online. You can have private sessions these days, and there is group sessions available. But anybody with a respiratory condition that's somebody comes to see them and recommends them doing pulmonary rehab, I would say absolutely give it a go. The evidence is out there that people that do pulmonary rehab have much better outcomes with a respiratory condition. There's loads of support groups out there as well. British Lung Foundation have got a brilliant website and they can link you up to support groups out there. We've certainly got an interstitial lung disease support group that one of our outpatient specialist nurses attends all the online sessions with them. And they have speakers as well that come. Pulmonary rehab and the hospice do run breathe easy groups. If you're really struggling from a breathlessness point of view, we can link you in with the hospice for obviously chronic disease management. I know when we say hospice, everybody thinks, oh, why would I be in touch with a hospice? But actually, we look at a lot about symptom management, and if we are struggling with breathlessness, we can try physio or we can try some of these groups, which are excellent in just managing breathlessness. Like I said, British Lung Foundation have got a huge resource of information out there. Excellent resources on exercise programs, how to eat well when you've got a respiratory condition. You know, if you've got a relative that's got a respiratory condition and you're thinking, what can I do to help? They've got all sorts out there and you can just order them free online. And Asthma UK is another really good resource, certainly for the asthmatics, but if you have an inhaled therapy that you take for your respiratory condition, then they have a video for every inhaled therapy that you can think of out there. So it's really good to just have a little look at that. I always, if I start people on inhalers, will say to them, in a couple of weeks' time, have a little look at Asthma UK, go back through your symptoms again and see how you're managing with your inhaler. Often you'll find that you pick up a little bit of bad practice over time because you've been taking it for so long. You then just need to remind yourself again on how to take it. So, any questions about anybody that's got respiratory conditions, etc.? I was just going to share with you, obviously I've had a recent patient that's a nurse that's coming quite late to her diagnosis, and I think it's quite evident in a healthcare professional sense that we're not very good at helping ourselves, and she ignored her symptoms for quite a long time and then was diagnosed with COPD in November and had very poor lung function at that point, has deteriorated quite rapidly, but has just sat there at home, really struggling with the symptoms, has gone off sick, but not really asked anybody for any support, and had been struggling up until I met her in January. And unfortunately, we've had to start her on some other therapies like non-invasive ventilation to try and get rid of the CO2. But it really hit home to me that she was so busy helping other people that she lost sight of what she was feeling and how unwell she was feeling. And I think it's really important that we just look at ourselves and look at our colleagues. And if we are finding that people are more breathless, encourage them to get checked out by the GP. Any questions?
I don't know if there will be any questions because everything's been explained so well by you. I think it is a really important fact that you've just said, you know, that we lose hindsight of ourselves sometimes.
Absolutely, it's really easy to do. You know, we're in the trust every day. So we're the respiratory nurse specialists and we've got a bleep and a mobile number. We see all the acute patients within the trust. But if you are an employee and you're just struggling and just want a little bit of advice, you know, we've had a couple of like ward clerks that have said, oh, my sister's got COPD, can you help? She's really struggling. We're happy to answer anything at all. Alison, do you?
Yeah, just one thing I think, you know, you do say about us asking, and I think with what's been happening over the last 2 years, I mean, there's been times when I've felt breathless and things like going upstairs and things like that, and you just quickly put it down to, oh, it could be linked with COVID, or I don't want to be a fuss, I don't want to actually bother anybody. But and I suppose you think when do I stop thinking it might be COVID and thinking it might be something else, or when do I need to speak to somebody? So I think you think of that we do need to look after ourselves and actually talk up as soon as we are starting to feel any of these things, because we don't know, do we, what it is, and it more than likely isn't COVID nowadays, you know.
We don't, and I would flip that on its side as well and say that a lot of our diagnostics tests haven't happened. Certainly spirometry is one of them, hasn't happened during COVID, and a lot of people have been categorised as having COPD without having some of the objective tests, or asthmatic, and haven't had some of these objective tests. So I think it's really important that if you do feel that you've been misdiagnosed or you've not been diagnosed properly, that you pursue that and that we get these objective tests now. You know, I see a lot of people during my day-to-day working, I probably would say I see at least 5 people a day that have been categorised as something, and I haven't got any objective evidence to say that they have, and actually think it may be something else. So if you have got any concerns or you haven't had some tests and somebody's labelled you as something, then I think it's really important that you get the right tests.
Yeah, and I think it's pushing it now, isn't it? Because, you know, I know anytime if I've rung the doctors, it's always been a phone consultation. And they've sort of said, well, you tell us how you're feeling, and they've taken from what you're actually saying. And sometimes it's hard to put into words how you're feeling, isn't it? So I think it's pushing it that way as well. Yeah, definitely. Thank you.
Different days are different, aren't they?
Yeah, definitely. Yeah, thank you.
No, it's not a problem.
Any more questions at all? I'll just back the importance of getting tests, because I had to go in for some, and it turns out I've got problems, but through it's sort of secondary to another long-term condition I've got.
Yeah.
And I'd have never ever even thought of anything like that. So just the importance of sort of following up on the issues that you do have.
Yeah, definitely. And the BLF stuff, like I said, is really good. It's very pictorial, explains different conditions, what to do. So, you know, we have a big supply of these. So if you are working in the trust and think, oh, I can't find them on the internet, just give us a bleep. And like I said, we cover the whole trust. So we're always around, so we can just drop them off on the ward if somebody would like some.
Do you have any electronic versions of that?
So at the moment, BLF are just merging with Asthma UK, so their resources at the moment aren't available, but Asthma UK or British Lung Foundation, if you just type them in, they have lots of resources on there, but they're not available to download at the moment, just as the merge is happening. But like I said, we have got a big supply of them, so if you can't wait and want to have a little read of some, then absolutely.
Brill. So I'll just stop the recording there.